happens now, there's nothing new in this. Alright? It's either done in oral paths or done in microbiology, oral medicine. It's pretty much done in a lot of places. So this is going to be just a brush up for you guys. Typhoid caused by Salmonella typhi and paratyphi. Most common cause is contaminated food. Incubation period 5 to 14 days. MCQ. How do they gain entry? They gain entry through the Peyer's patch. Now when these typhoid, it can cause ulcers in the stomach. What is the shape of them? They are oval in shape. And they do not leave scars after healing. And the ulcers will have undermined edges. Now this is important. Now this is new. So that's important. Alright? All of you still with me, able to follow me? Okay, next slide. I think clinical features, step ladder pattern, palpable spleen. Now important is rose spots. Already familiar with this. These are features in the first week. If you go to second week, you'll have higher pulse, higher fever, more enlargement, and there'll also be diarrhea. Okay? Rose spots, can you see the rose spots? The rose spots first start in the abdomen area. Are we clear? Let's go to the investigations. And I think this is what is very important for you guys. Something that I have already told on Facebook. So you guys should be giving me what the mnemonic for this is. What is the mnemonic for investigations? Yes, Basu. Very easy and the best way to remember. First week, second week, third week, fourth week. First week, blood culture is positive. Second week, agglutination, Vidal test. Third week, stools. Fourth week, urine. In fact, your stool and urine will be kept for like third and fourth week. Okay, but blood is the best way in the first week to get a positive result. Bone marrow will also be positive. Second week is Vidal's test. See, this doesn't mean that, let me tell you one thing. When we refer to it as first week, second week, doesn't mean that the blood test is positive only in the first week. It will be positive in the second week also. So if it is agglutination, if it says best, then yes, Vidal test is the best. Because stool and urine are less sensitive tests. You do find the organism in the urine and the stool, but it is not the most sensitive. When they ask you the most sensitive, even after 14 days, the most sensitive will still be your agglutination test. Understood? And if they ask, yeah, second week onwards, it is positive. So it's not till, that is what I was telling you, that the Vidal test, it loses its specificity by fourth week, it says. Okay? So they say between your 7 to 20 days or 7 to 15 days, best is agglutination. And in the first 2-3 days, best is blood test. Next, go to paratyphoid. Paratyphoid we have 3 types. Paratyphi ABC, milder symptoms, blood culture will be positive and Vidal will also be positive. But you know that in the paratyphi, VI antigen is not present. This is microbiology, recollect. Diphtheria, I am not getting into diphtheria, all of us know. Highlight the important points, pseudomembrane. You have bull neck, you have a Schick test. Alright? So what kind of typical cough that you see, what is it called? A typical cough that you see in diphtheria, what is it called? Oral pathology. Whooping cough? No way. Where do you see whooping cough? See, just because it's cough, it can't be whooping cough always. Recollect. No. Yeah, it's in pertussis is whooping cough. Heard of diphtheritic croup? A typical nasal twang and cough that is seen, diphtheric croup. Yeah. Okay. Now, whooping cough, something that you guys spoke about. Organism responsible, Bordetella pertussis, you have droplet infection, you may even see sublingual ulcers. Now, very important here, undulant fever, Malta fever, nothing but brucellosis, these other names are very important. It's actually a zoonotic infection. What do we mean by zoonotic infection? It's a disease which has come to man from an animal. You will have an agglutination test positive and you have some prozone phenomena which is false negative here. I hope you all can recollect what is prozone, postzone. What happens in prozone? There is an increased antibody titer, while if it is all of you are clear with prozone? Yeah. What is the condition where antigen is excess? Zone phenomena, excess antigen, pre-zone. Pre-zone, what is pre-zone? Post-zone. Prozone, post-zone. Yeah, as long as you know what it is, that's what I care. Plague caused by Yersinia pestis. You have different types of plague. We've seen that in micro. The bubonic type of plague is the commonest one, which involves the inguinal lymph nodes. Syphilis. We know a lot of things about syphilis. So I should be asking you questions at this point. You have to tell me. What is the primary lesion of syphilis called as? Yes. The most infectious stage of syphilis? Which stage of syphilis is most infectious? Yes. Very good. Then we have latent syphilis. You don't have any clinical manifestations in the latent syphilis. There is also late syphilis which happens only after 1 year. Then tertiary syphilis is gamma. There is also neurosyphilis, and in neurosyphilis you will see two kind of features important for you: Charcot joint and Argyll-Robertson pupil. Very important MCQ. It is seen in neurosyphilis. Hutchinson's triad. Not getting into that. Summary of your whole thing. Nice one to remember, but something that you already know. So let's get proceeded with this. Now diagrams. Gamma, mucus patch, your saddle nose, maxillary deficiency. So this is your congenital syphilis. Okay. The other features are frontal bossing, ragades, Clutton's joint, maxillary hyperplasia. Clutton's joint is important. What are the investigations you will do for syphilis? Dark field microscopy, which is the best and the specific test? FTA-ABS. All of you know this, right? This is the most specific test that can be done for syphilis. Treatment of choice, penicillin G, best thing. Then we have Zarek-Shoshamer reaction. We did this in Pharmac. What is it? Why do you have a Zarek-Shoshamer reaction? What happens if you give Which drug are you giving? And what is the reaction? Yes, happens when you give penicillin. What is reacting with penicillin? The syphilitic byproducts. Syphilitic byproducts reacting with penicillin give you the Jarisch-Sarshomer reaction. Patient will have fever and shivers. Yeah. Measles, rubiola. What do you see here? Koplik's spots. Now, this is very important. Extremely important here is, when you have measles, the commonest complication that can happen in children is otitis media. Please make a note of this, very important. But in case of adults, the most common complication that can happen is pneumonia. Vaccine related, you know, 12 to 15 months MMR vaccine, booster at 4 to 12. This also could be asked. Mumps. Mumps is a paramyxo infection. Mumps is the leading cause for pancreas in children. And what do you expect in mumps? And if there is a pancreatitis, what do you expect? You expect an increase in the serum amylase levels. So that's again an MCQ. And commonest complications of mumps is meningitis, orchitis, pancreatitis, MCQ again. Well, I don't have the thing here. I don't have the incubation periods written over here. So that's something that we could revise. We can do that on the discussion day, Saurabh. This Friday probably. We can have a couple of questions from incubation period. Rubella. Make a note of this. In German measles, you see Forchheimer's spots. And they are most commonly seen on the soft palate MCQ. Heard of this, right? Forchheimer's spots. Next, chickenpox, varicella, caused by herpes zoster. It's a reactivation of the latent virus. I mean, the chickenpox virus getting latent causes your herpes zoster. It is associated with Ray's syndrome. What is Ray's syndrome? It's a fatty liver with encephalopathy seen in children who consume aspirin. We have again seen this in Pharmac, right? Ramsay-Hunt syndrome, we already know what it is. Change the slide there. Infectious mononucleosis caused by EBV. Tumors caused by it, you should be telling me. Nasopharyngeal carcinoma, Burkitt's lymphoma, Hodgkin's lymphoma. And transmitted by saliva, so that is why we call it as a kissing disease. What are the investigations for infectious mononucleosis? Serum alkaline phosphatase levels will be high, and the Paul Bunnell test, also called as your monospot test, very important. Any of you can give me the values in the Paul Bunnell test? What happens? What ratio is gone high? What is the values we read? Normally it should be how much, and what is the count that is high? Don't know? Normally a heterophile thing should be 1:8, and it becomes 1:2000 or 200. I think it's 200. Normal is 1:8, the heterophile ratio, whatever. It becomes 1:200. HIV, retrovirus, CD4. What do you think is the CD4 count in HIV patients? Super, very good. When the count goes beyond 200, you will see the AIDS symptoms in the patient. These are the 4 stages. We have an acute infection, an asymptomatic stage, a mild symptomatic stage, And the last stage of it is the AIDS. So when we refer to AIDS, we are actually dealing with the last stage of the condition. Symptoms: weight loss, diarrhea, opportunistic infections. Yeah, when the count is less than 200. And this is the important MCQ that I need to tell you. Both this point and this point. The most common opportunistic infection that we see in India is tuberculosis. Now let me specify. If it is mentioned most common fungal infection, it will be candidiasis. If it is mentioned most common opportunistic infection without mentioning India, it will still be candidiasis. Are you guys able to follow me? Are you understanding the difference in the question? If it is India, only then tuberculosis will be mentioned. In the rest of the world, it is candidiasis. If it is fungal infection, it is candidiasis. If it is bacterial infection, it will be tuberculosis. And most common malignancy associated will be Kaposi sarcoma or lymphoma. Recent MCQs suggest lymphoma. Lymphoma, an option even before Kaposi in the recent MCQs. Yes, non-Hodgkin's. How will you diagnose it? ELISA is a screening test. A confirmatory test is Western blot. During the window period, you can detect P24 antigen, MCQ. You can also do a count of the CD4. This is how you diagnose AIDS. Management: antiretroviral therapy, and should be initiated when the count falls below 250. Drugs, we have already seen, has been covered extensively in Pharmac. You give reverse transcriptase, Zidovudine, Lamivudine, Abacavir, etc. This is all basically a list of antiretroviral drugs. Next we go to malaria. Malaria is a parasitic infection with, we've seen these fevers already. Daily, alternate, every third day, and this is very important, guys. Please make an effort in remembering this. Okay? A lot of MCQs come from here. Now, you will see hemolysis being most severe in the falciparum caused malaria. You have black water fever malaria, which is also seen in falciparum. Cerebral malaria is a very serious complication that also happens because of falciparum. You may see a tender splenomegaly. Anemia will be seen here, but that will be a normocytic anemia. Drug of choice is chloroquine, MCQ. If the parasite is resistant to chloroquine, then you give mefloquine, artesunate, and halofantrine. Very important MCQ. Was this clear or any doubts? Please ask, because chloroquine resistant cases drugs is a very important MCQ. Not there, huh? Should be there as far as I know. It's there. It's all there. A lot of it is there. Okay? While the rest of the things you see, there are tables there. You know, there are regimes, different regimes. I want you all to go through those regimes by yourself, alright? It's very clearly given in table form, so it should be fine. And tuberculosis related regime is also quite easy. You all can go through that. Any doubts in today's class? Okay. See, that is a topic of blood, alright?